What is AIDS? AIDS is an acquired lack of cellular immune response. If an organism separates inside and outside, it has to decide what belongs to the inside and what does not. In other words, what is self, what is not self. In animals, from crustaceans and insects, fishes, reptiles and amphibians, to birds and mammals, a highly efficient system of differentiation has developed, the immune system. With this system, everything that is not self is eliminated. Non-self are bacteria, virus, parasites, but also defective cells of the body like cancer cells. Such cancer cells are steadily produced, but also steadily eliminated. There are several defense mechanisms. The oldest and simplest are macrophages that pounce on everything seeming to be non-self and digest it. In most cases, this is sufficient. For some intruders, virus, but also cancer cells and other system called cellular immunity is required. Macrophages are supported by specific white blood cells, helper cells, T helper cells, in this case T1 cell. If something is conspicuous, it is handed to specific killer cells. This system is able to learn. Specific task forces are raised against very dangerous intruders. Large intruders, like bacteria, are first labeled by antibodies, by the humoral immunity. This system is supported by Th2 cells. Antibodies are highly specific, often even specific to molecules on the bacterial cell surface. Antibodies can develop quickly if needed and can learn. Both defense mechanisms, humoral and cellular, can become very active. They need a lot of oxygen and therefore can be supported by phase transfer catalysts. After their task, the infection is over, they shall be reduced quickly. An immune system attacks body cells if this is not the case, so-called autoimmune diseases. Demobilization is performed by regulatory cells, Treg cells. They are also necessary if an immune reaction should be avoided. An embryo bears the heredity properties of father and mother. Therefore, it is semi-strange to the mother. Antibodies are not able to penetrate the placenta, but cellular immune response has to be downregulated to avoid a miscarriage. Differentiation of Th1 and Th2 cells. The balance of Th1 and Th2 cells is critical sometimes. Allergy of immediate type are an overreaction of humoral response, Th2 mediated. In some cases, Th2 mediated response lacks completely. This is often overcompensated by high antibody titers. After the decision to start a Th1 mediated immune response, or vice versa, the other type is suppressed by cytokines. Interleukin 10, interleukin 4, interleukin 5, or interferon gamma. The suppression of Th2 may increase Th1 mediated response. The current treatment is with antiretroviral ART or with highly active ART, HART. Comparing more than 20,000 HIV positives before and after treatment with HART brings the situation down to earth. Mean CD4 cell counts raised from 170 to 200 normal range is 500 to 1200, while mortality stayed the same or even raised a bit. Th2 cells are promoted by prostaglandin, which is formed from arachidonic acid from cell walls by cyclooxygenase 2. This enzyme can effectively be inhibited by humulone, the bitter of hops. If applied orally, the necessary quantity, however, is much too bitter. By using quantum dot technology, the same effect can be obtained by only 3.6 mg per day. This means that using this small amount, a mainly humoral immune response can be turned into a cellular response. The effect can even be enhanced by procyanidins, as quantum dots, acting on T killer cells. Piglets may waste 10 days after weaning. This disease, caused by a circovirus, is called PMWS. The use of a combination of humulone and procyanidin as quantum dots in piglets afflicted by PMWS resulted in an increase of daily weight gain by 13.8%, while feed conversion increased by 16%, and losses were reduced significantly. Encouraged by these results, a trial with patients with full-blown AIDS started. 40 patients, women and men, aged between 19 and 48 years in Kampala, Uganda, suffering from full-blown AIDS, received orally this preparation daily for 90 days. On days 0, 45 and 90, body weight, CD4 counts, virus load, general health status, and additional diseases had been recorded. 2 patients died and 2 dropped out. They could not be examined again for unknown reasons. On day 90, 74% of 38 patients could be found to be below the limits of full-blown AIDS due to CD4 counts and virus load. Diarrhea stopped in all of these cases, and body weight became normal in the remaining 10 cases. In 8 people, health status as well as CD4 counts and virus load improved significantly. 6 months after the start of the trial, 19 patients were able to go to work regularly again. In a second trial, 21 patients in Nairobi, Kenya, suffering from HIV/AIDS, were given humulone and procyanidin as quantum dots daily for 3 months. 1 of them died after 2 weeks. 1 patient left Nairobi and could not be contacted again. 19 patients could be evaluated, 4 male and 15 female patients. Age. The age was between 29 and 58 years, with an average of 40.7 years. They were tested HIV positive between 3 months and 8 years, an average of 5.6 years. CD4 count. At the start of the trial, CD4 count was between 52 and 453, an average of 209. And 265 to 920, with an average of 565 3 months later. CD4 counts increased in all cases, in one case even from 52 to 532, and in another from 58 to 485. Tuberculosis. 5 patients suffered from tuberculosis, which improved in all cases. After 3 months, 3 of them were free of tuberculosis, starting from a very severe state. In 2 cases, the health of tuberculosis patients had improved significantly. In all cases, body weight increased starting from 35 to 85 kilos, average of 52.2 kilos, to 48 to 100 kilos, average 65 kilos. In one case, body weight increased from 37 to 60 kilos. Symptoms were recorded only for some patients. It can be assumed that the others did not show these symptoms. Night sweats disappeared. In the remaining case, it decreased significantly. Fever disappeared in 2 out of 2 cases. Diarrhea disappeared in 6 out of 6 cases. Headache disappeared in 11 out of 11 cases. Pneumonia disappeared in 4 out of 4 cases. General weakness in 10 out of 11 cases, patients recovered completely. In the remaining case, health improved significantly. Skin thrush disappeared in 3 out of 3 cases. Mental status improved to normal in 4 out of 5 cases and significantly improved in the remaining case. Respiratory problems disappeared in 2 out of 2 cases. Lipodystrophy, abscess, swelling of the ankles, paralysis, joint pain, herpes, white-coated tongue, and very dry skin became significantly better or disappeared in single individual cases. To be registered as a drug, 8 to 10 million euros are necessary. Look at crowdfunding of this video. As far as the figures go, each of 22 million AIDS patients would have to spend 0.50 euros only to make a drug available in a few years. That really helps, and that is much cheaper. 80 euros per month, 960 euros per year in comparison to 16,000 to 20,000 euros per year of current medication. All rights of this product are owned by the charity Kupona Limited, Nairobi, www.kupona.org. All profits will be used for programs of health, education, vocational training, and drinking water supply in Africa. It is easy to buy Humulone, the bit of hops, from the beer industry. To get the effect of curing AIDS, however, you need a quantity nobody is able to eat. A therapy is only possible if Humulone is prepared as quantum dots. The technical term quantum dot cannot be protected and everybody can use it. The effect, restore of cellular immunity, is only fulfilled if producer or distributor uses the term produced according to Quantenpunkt-Technologie nach Gradl. You will find this information and case studies in www.egaa-recipes.com.